Hi, I am Dr.Mangesh Kamath. I am a senior consultant medical oncologist, hemato-oncologist and bone marrow transplant physician. I practice at Healius Cancer and Hematology Clinics and Fortis Hospitals, Bangalore. What are leukemias? Leukemias basically translate into a very common and dreadful word called as blood cancer. Blood cancer is enough to send shivers down your spine, but are all blood cancers the same, or is there only one type of blood cancer? This is the reason why I have created this video, is to educate you about blood cancer. Blood cancer is not one disease. There are multiple subtypes and types of blood cancer. In fact, there are certain types of blood cancer which, when diagnosed and treated appropriately, you can live for up to a decade and beyond. For example, chronic myeloid leukemia. Chronic myeloid leukemia before 2000 used to be a deadly disease. You could hope to live for not more than 5 years with treatment of those times. But after the advent of targeted therapy, the name of the molecule being imatinib, the whole treatment scenario and the outcomes of CML have changed dramatically, and today patients with CML are living like patients with hypertension and diabetes. You can aim to control this disease, what used to be a very dreadful disease in the past, with tablets which can be taken once a day, and you can survive and also live without any symptoms for a long period of time. Today, due to targeted therapy for CML, we have some patients. I do have some personal patients of mine who have even conceived and born children. They are living very satisfied professional and personal lives. So that is chronic myeloid leukemia. There is also another entity called as chronic lymphocytic leukemia. Even this kind of leukemia, which used to be treated with very powerful medications in the past, are treated again with tablets and targeted therapies. And there are certain subsets of CLL or chronic lymphocytic leukemia who are surviving beyond a decade with today's treatment. Today's treatment is not only potent but also less in side effects. If you compare the treatment of the past to the treatment today, you will find that the treatment of the past was potent but more in side effects. But today, the treatment of today is equivalent with respect to potency, or sometimes even better in potency than to the medications of the past, but have the least side effects. So that is about chronic myeloid leukemia and chronic lymphocytic leukemia. Acute myeloid leukemia. Acute myeloid leukemia is also not a single entity. Acute myeloid leukemia has got several subtypes. Some of them are highly curable and some of them are very, very aggressive. There are molecular tests available today to classify all these types of leukemias so that you can tell the patients whether this disease that you have is going to be aggressive or is going to be very slow spreading and indolent. So molecular tests are the standard of today. If you are not undergoing certain requisite molecular tests for the leukemia, then maybe you are not getting the right treatment. Then you have acute lymphoblastic leukemia. Again, acute lymphoblastic leukemia, which is quite common in children, is highly curable today. Of course, no treatment in oncology or any other branch of medicine can give you 100% guarantee, but there are very advanced and highly potent strategies available today to cure acute lymphoblastic leukemias, not only in children but also in adults. So friends, if you're diagnosed with blood cancer, seek the truth. Make sure that you are thoroughly evaluated by an experienced medical oncologist or a hemato-oncologist who will be able to tell you with all the information that he derives to make sure that you're treated with the most advanced therapies so that if cure is not possible, at least control is possible.